Hello, welcome everyone. I might give it just a couple of seconds because I know sometimes it takes a minute to get set up. Make sure your coffee's right next to you or your lunch if you've brought that along. And welcome to the Safe Information Sharing in Healthcare webinar. I've got the lovely Katrina Otto with me today. On to the next slide. Thanks, Katrina. So this webinar today is led by West Vic PHN and Murray PHN, but we're running it on behalf of all the Victorian PHNs. So welcome everybody from all over Victoria. I'll just let you know this session will be recorded for both internal purposes, but also so we can share it publicly. So if you've got some colleagues you think you'd like to share it with, they'll be able to watch it too. I'll start off by acknowledging the traditional owners and custodians of the unceded lands and waterways on which we're all dialing in from today. I'm on Wadawurrung country, and you can see the list of different countries we have in Western Victoria there. But you might be from another country, so feel free to pop that in the chat if you'd like. And we recognise diversity, resilience, and the ongoing place that First Nations people hold in our communities. We pay our respects to elders, both past and present, and commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations people and organisations, and I'd like to extend that respect to any Aboriginal or Torres Strait Islander people dialing in with us today. Thanks. So you might want to have a look and just make sure that your name is displaying correctly. If it's not, feel free to pop your first name and last name into the chat box and our lovely team will fix up your name. If we can't identify you, we won't be able to follow you up after the session if you've got questions that come up that perhaps we can't answer today. And please, yes, go ahead and pop your questions in the chat. We'll try and get to all of them, but if not, we'll follow up with you afterwards. And that's why it's important that we can identify you. You can see lots of names coming through, fantastic. I'm going to actually throw over and introduce to the wonderful Katrina Otto, who's here with us today. Welcome, Katrina.
Thank you. It's wonderful to be here. I'm even seeing some names that I recognise. Hi, Sally. Hi, it's wonderful to be here. You ready for me to kick off, Sarah?
Let's do it.
Let's do it. Hi, everyone. For those who haven't met me before, I am a medical practice management consultant and digital health trainer. I have been working in practices for 30 years and my business, Trainer to Medical, has been training digital health since day one, since just before day one. And I go way, way back with Sarah as well. So my goal is always to work collaboratively and help ensure that digital health technologies, practice efficiencies are working for you. So our agenda today, we're going to talk about secure messaging. I've got some exciting news for you. And look at, well, okay, where are you up to in your practice? What are the benefits? What should you consider when choosing and setting up secure messaging? And we'll talk a bit about legal requirements, what our peak bodies say, and what about My Health Record and how could that help you? I always think about My Health Record as a bit of a, it's if you're seeking information that's missing, and also as a helpful clinical handover tool. So what you'll find with me is I am an independent trainer, so I will tell you the good and the real and inspire you hopefully to take that next step for your practice. But I have been teaching and leading digital health improvements, and secure messaging is a big passion of mine because as a practice manager myself, it's about, you know, let's get that paperless practice and let's ensure that our communication is as confidential and as efficient as possible. So when we talk about that, we talk about secure messaging. So allowing healthcare providers to send encrypted information. So we're helping with the the efficiency and the safety. So, of course, when we talk about secure messaging, that message goes to a secure messaging service provider. It's encrypted. It's then received, it's decrypted, and it goes to you. So there are so many benefits, and it's quite exciting for me. I have been training this since day one, and leading, as you would all know, you're busy health professionals leading these digital health improvements. It's not a priority. The patient in front of you is a priority. So having time to do these business improvements is difficult. What we've seen is we now have this directly integrated with most of your clinical software systems. And if you feel like it, tell me what clinical software you use, and I'll have a bit of a look, or Sarah can report back to me in the chat. So, and let me know, are you using secure messaging already? And what clinical software you use, because it is now integrated. So literally once it's set up with one click, it's going to go from your software to the healthcare provider at the other end, straight into their inbox. So one of the things,
some best practice, a medical director.
Some of you may know me as the best practice or the medical director trainer. And ReferralNet, been using ReferralNet for many years. ZNet, wonderful, keep it going. Thanks everyone. One of the things that I am absolutely passionate about is saving practice staff time, saving that admin time, but also it is really important that we do everything we can to both meet, the privacy standards, but also reduce that possibility of human error. And I won't go on too much about it in this webinar. I literally just ran a webinar recently on health information security and cyber security, and the stories are horrifying. And I personally have had a notifiable data breach. So it is so easy to email the wrong patient and the wrong information. Way too easy. It's not safe. So the idea of being able to have that critical patient information accessible, there's an audit trail, because that's part of the standards they have to build for us. Only clinicians who have been given authorized access, and it's a single channel. And one of the things that, I'm often very loud about is having a practice system for how we manage our incoming correspondence, and ensuring that what we often call results management, or which is now, of course, all healthcare provider letters, discharge summaries, that we have a really safe, easy system for doctors to action and know that no one's going to slip through the cracks with that follow-up. So having everything coming into the one place is so much more helpful for that. And yes, what we're finding these days is, even hospitals, it's like you have to send this via secure messaging. We're not going to accept your referral. We're definitely not using faxes. So speaking of faxes, let's talk about the elephant in the room. Do you like this? You have to appreciate my picture. I ran a webinar on AI, and I asked it to create me a picture of the elephant in the room. In our medical room, because AI is one, it's fantastic, don't get me started on that topic, but it's a bit scary, right? There is a lot to consider. What we're talking about right now is we're talking about emailing. All right, tell me in the chat who's emailing. So my question is, but why can't we fax or email? And I live in the real world. I'm in practices every day. I email, you email, we all do. And hopefully nobody is getting paper faxes anymore, but I'm betting most of you are using electronic fax, right? So how do we not when all our providers aren't on board? So that's why it is so wonderful that there are so many of you here today. So Victoria takes this big step forward together to get everybody on the same page. So, because literally it's one click and it goes from you as a clinician to the other clinicians inbox safely and securely. So it is definitely worth, but because I do live in the real world, I am going to talk about emailing. And you know, our software now includes emailing. And you know what? During COVID, sorry, that word triggers anybody. I get it. I went back to practice management because I was needed. My colleagues, everyone was in such distress. We had no choice but to email, right? Absolutely no choice. Now, our software just put it in there. They gave up too. They just put it in there for us. So if you use best practice, this is a picture of best practice, and this is Medical Director in the latest version. You know, more enhancements about emailing. So, you know, we email. However, what I want to talk to you about is safe sharing of information. Now, you'll see here, you can actually put a PIN number on it. And when we're talking about sharing information with our patients, they don't use secure messaging. They're not using HealthLink or Argus or medical objects, of course. So at times, this is just the real world. But when it comes to tips, and what I've done here is I've put a little light bulb in, you know, because we go through a lot of information in these webinars, and I always like, what are my action steps? What am I taking? Just one improvement from this education. So I put a little light bulb if it's just things I really want you to take away. And maybe some ideas are, you know, you get the patient to send you their email. They send you the email, so you're replying. You know, I have been staggered. I have a business, and people send me their emails. Healthcare providers register for my webinars. I literally just had a look at the failed, and there was 25 failed because people, healthcare professionals, typed their own email address in incorrectly. So that is the risk when we're emailing. Who are we sending it to? And we know that from e-scripts as well. You know, e-scripts, and also, you know, that importance of sending a script to the right person. So verify, get specific documented consent, protect that information with access levels in your practice, and train your staff. So nobody's saying, you know, there's no emailing, but what we're saying is we could minimize the number of people to email. So don't just take my word for it. Let's have a look at what the peak bodies and our indemnifiers say. And yes, the RACGP says it creates risks, of course. We know that we've talked about that. We are allowed to email, and it is really important that we understand the risk and take steps. Now, every single one of my colleagues has been affected by admin staff, privacy issues, hacking, or data breaches. It's just daily smishing. You know what smishing is? Phishing, where they send an email, and it's so sophisticated. So when we talk, this is the practice managers will be going, I know what we're doing now. This is all our accreditation stuff. This is what we do. We assess the risk. What is the likelihood of harm? Okay, so is this a high risk? And I also train with the indemnifiers. So what we would say is, what is it you are sending? Who are you sending it to? Is it a, you know, Dr. Jan Jackson at southerncardiology.com? Is it a legitimate email address, or is it Jane 8888777 at Yahoo? And what is in that document that you are sending? Is it a higher level of sensitivity? So this is the risk assessment that we do if you are emailing. And ideally, low risk is you have documented policies, a consent form is signed, the email address is verified, and you password protect them or put a PIN number. The PIN number in best practice, by the way, is the day and the month of their birthday. So patients know that one. But when we talk about the real issues, yeah, we could be putting a PIN number on it and sending it to a specialist because, or even any other healthcare provider is not going to know what the PIN is. So what do indemnifiers say? You can email if the patients consent to it. They understand that it is an unsecure email and that potentially could be intercepted. We have IT security measures in place. We're following the protocols. And obviously, we save a copy of everything we send. And I've put the links in this presentation so you can read all about it. So that is what we are allowed to do. The reality, I just had one of my colleagues, their receptionist, clicked on a link in an email because they're emailing all the time, which means all those emails are coming into, and often the admin staff are reading those emails, allocating, or etc. They had a hacking attack where all of their patient records were vulnerable. The hackers took over. So this was a massive, horrifying issue for the practice. What they were, the owner, who I know was hauled over the coals. You should not be emailing. Why are you emailing patient information? So they will never email again. But I'm all about not scaring everybody. Sorry. It's more about, it's a bit too real for me too, because I feel it from my colleagues. But what we want to do is we want to do everything we can to help you get set up to send by secure messaging everything you possibly can. So the number of people that you are left to be emailing is very small, and then those protections are in place, so it's safe. So what are these challenges? I'm sure you could tell me, but I have lived and breathed this, and I was quietly excited this week when I was preparing this, because for so many years, I live in the real world, I've been frustrated by the lack of progress. It's like, seriously, we can call each other on our mobile phones. Just give us a national federated directory where we can look up, and we send it via secure messaging at whichever software they use. How hard can it be, right? So 5 years ago, I gave up saying we should say that by the end of the year. However, now, because look what happened. We got COVID, we got emailing. Now we are seeing massive steps forward. Now we are in Victoria. So hands up if you are using HealthLink. Others may be using Argus. Look, if you really wanted to play along, you could give me a thumbs up if you're using a HealthLink, and you could give me a happy face if you're using something else. I don't know, Sarah, can they use happy faces? It is really about going, if you're not using anything yet, see your PHN person after this. I got laughing faces. I'm feeling that. Thank you. That's good. So I'm saying, I take that to mean it's working really well. And we're going to hear a good news story very soon too. I got an amazing recent story. It was literally last week. I do a lot of training related to conversion. So if you're changing software, that's part of one of the things I do with the training and the preparation. And they were changing to best practice software. I was in that later stages with them, getting it set up. And the doctor's main concern was, how long is my secure messaging going to be off for? Not where are my results, how long until we can get it reconnected. It was like, I can't even go a day having to print and fax referrals, or he was just like so used to it. And that's where you will get to as well. So I'm not saying there's not going to be challenges along the way, but the wonderful thing is you all have primary health network staff helping you. And a lot will be a lot, hopefully to follow up with after this. We've got the links. Now, look at that. Millions and millions of clinical documents. You're all probably using HealthLink because it's how we get our results most of the time, whether you know it or not. That's the secure messaging provider sending results to us. Now, if you're in Queensland, when I go to Queensland, I don't really talk about secure messaging much. You know why? Because everybody uses medical objects. It's like I'm very jealous when I go to Queensland. It's like everybody's on board. And yeah, no one's going to take it off them either. But we are just taking that next step now. We might be using HealthLink. Some of you are using ReferralNet. Good news, and Argus. So Argus and HealthLink have always been the two. I've just said to people, you need to get both, and then you need to look up both directories to see who's being used. Once you've got that set up in your contacts or address book, you're done. So yes, it takes a bit of setting up. But my very, very good news, if you've probably heard this already, HealthLink acquired Argus. Yay. And then there was two. So it is now, and I know CEO Dave Young. I've known him as a colleague for many, many, many years. So I am excited about progress and more progress and how much easier it's going to be. Similarly, our vendors digital health agency has led this directory for us. So know that this is all still not perfect, but it is going to be one directory. Okay. Best practice has enhanced their, which is coming from the digital health agency specifications. They've enhanced their directory so that you can look up online and see if what people are using. So all the vendors will have this and be able to synchronize with the online directory. Now, I think I saw in the chat before that there's allied health providers and non-GP specialists, etc. Don't worry, if you do not have conformance software, which is what we call software which has that easy one click and you're sending, there are still provider portals. So HealthLink and Argus, allied health practices would go to the provider portal and then you can send and receive that way. So it's just a couple more clicks, that's all. And then tell your vendors that, yeah, you too value this feature, because that's what I've learned. They listen to you if you tell them that that's a feature you want. Enough people speak, they will build it. So in your software, it's about looking up who are you communicating with the most, seeing what secure messaging provider they use. In Medical Director, it's already integrated. I've always said we're aiming for this little red envelope. So you look up and see, are they in the directory? And that enables you then to send with one click. So it's just the setting up. And notice that here in the software, you can see the status, and that's the goal, right? I mean, I used to manage a specialist practice, and we have it in GP environments. We have the challenge of referrals. In specialist environments, you have the challenge of the patient turning up without the referral. This way we know it's been received, we know it's been sent. It may be in the doctor's inbox, but we know it has been. And I'm going to have a look at the chat while this is playing, but I wanted to throw to Sarah for a minute. A little tip here, add your secure messaging identifier on your referrals. Add a note on your website, like Anglesey Medical did here. They don't use fax anymore. Please contact us and we'll help you about our secure messaging options. Add it to your referral. Talk about it with your providers. Okay, so I'll just stop share for a moment, Sarah, and
Thanks,
pass
Katrina.
over to you.
There's some great comments and questions coming through in the chat. Keep them coming. I'm going to share a video now that we made with the wonderful team at Anglesey Medical here on the Surf Coast. They're a bit famous around here because they were the first general practice to send an e-prescription in Australia. So they are always at the front foot of digital health, and yes, they've decommissioned their fax machine. So I'm going to share a video, which we'll also share with you later if you want to go ahead and share it with other colleagues and practice owners and people. So let me share my screen. Optimize, wonderful. All right, enjoy.
Great.
Hi, my name's Dr. David Corbett. I'm a GP owner at Anglesey Medical on the Surf Coast, and I was the first GP in Australia to send an e-script. I really love digital tools that help make our work more efficient and effective. We recently stopped using our fax machine altogether, and it's been a huge relief for us. It's allowed our staff more time so they don't have to scan things in and allocate them appropriately. It's reduced the risk of other people seeing data that they shouldn't see or patient information they shouldn't see. And it's also saved us money in terms of that administrative time. So now reception staff are doing more work on recalls and other procedures that help us run a more efficient general practice.
My name is Matilda. I'm a practice manager at Anglesey Medical on the Surf Coast, and I'm here to talk about why secure messaging is integral for general practice. Using secure messaging frees up time as it saves reception having to physically get the faxes, scan it in and import it into best practice. Secure messaging does all the heavy lifting and doctors are able to receive correspondence immediately from specialists, hospitals, allied health or whoever is sending documents.
As a medical student, I hope that all future GP practices move to secure messaging, especially for the security of patient data. Moving to secure messaging means that at reception, we just have so much more time. We can action patient recalls and address patient concerns on the phone.
As the owner of a GP clinic, costs and time are of essence for managing how we run things, and secure messaging saves both time and cost. It saves an environmental cost in that we're not printing out a lot of stuff via fax and using that electricity as well, but it also saves our reception and admin staff a bulk of time that they can better spend on better patient care. If you're thinking that it's too complicated to set up secure messaging, I want to reassure you that it's not. With good IT support, it's very simple to set up and even simpler to use. It just works in the background. You need to have administrative processes in place like you do for all other aspects of general practice to ensure that it's working. But once it's working, it is really simple to use, just like e-scripts are. It's part of just your software process and your workflow. It doesn't take any extra time and it saves you as a GP a lot of time.
I'm Sarah Crow. I'm the Digital Health Manager at Western Victoria Primary Health Network. On our practice resource website, Practice Connect, we have instructional videos and resources on how you can set up and use ReferralNet, HealthLink and Argus.
What I would like practice managers to know is that using secure messaging saves time, allows secure patient data and saves the practice money.
Now that we use secure messaging, our patients can trust that their information will be in their file when they're seeing their GP for their next appointment.
As a patient myself, which we all are, I really want to know that my GP is also using secure messaging to keep my data confidential and to ensure that I get adequate and timely treatment and follow-up for any results and imaging I have.
If you or your practice staff would like help in using secure messaging, you can get in contact with your practice facilitator or the digital health team at Western Victoria Primary Health Network.
So thank you. I will just say, obviously that video was aimed at Western Victoria, but we've got people from all over Victoria here, and we will show you later how to get in touch with your PHN to get support. And whilst the video again was aimed at general practices, We're happy, I know in Western Victoria at least, we're very happy to provide support to allied health or anyone else wanting to talk about secure messaging. And I'm sure the other PHNs will be the same. So don't hesitate to get in contact with us.
Which is gold, right? You have help. That's not something we always do with our practice improvements. So take advantage of that. Now, I was wanting to show you a little bit, and I was reading through your chat, and I understand that everybody's in different practices at very different stages. And it's really, in any practice, it's about going, well, what is most important to us? Are you spending a lot of time managing faxes and emails? Is there risk there? So when we talk about an improvement and the cost value ratios of that, there's a whole lot of factors to consider. Know that a lot of these providers, there is not a big cost involved. And I'm not going to say what the costs are. Sometimes there's no cost. That's a question as you go down that path. But it's definitely worth considering when you consider the cost that you're spending now in admin time. I mean, I'm in a practice and I'll be looking at the receptionist, looking at the emails in her inbox that are pouring in. Okay. And then the time managing those, not to mention the risk. It's just like, I'm just like, oh my goodness. And then what they're reading, of course, and then patients sending all sorts of stuff. So let's focus first of all, though, on provider to provider. Okay, so our secure messaging, I wanted to just quickly talk about, now, as I said, if you do not have conformance software and you do not see the nice little click links within your software, you just go to the portal. But one of the other improvements that I have noticed since I previously trained this is, that Fairyland Federated Directory I was talking about. Within HealthLink, there is what they call SR, specialists and referrals. So I know the smart forms, HealthLink smart forms have been hugely popular. Your hospitals are using them. So this is really about now going, I won't put you on the spot, Sarah, by telling me which of your hospitals again, but if you can think of it, pop it in the chat for people. And if there's any other PHN digital health leaders listening too, pop in, what health service are using these electronic referrals. It is the way of the future. So again, congrats for all being here today and taking that next little step. But you can use this and look up who is connected and be able to easily refer to them. So that's for private non-GP specialist referrals. Of course, that's starting that link. So if you're sending, then you can receive it. And some people start with receiving, okay, like we have with our results, and then they move to sending. So yes, Northern Health, I can see some on there, Eastern Health, Manual Health. So this is where more and more will start to be sending this way. And if you needed visual evidence, I literally just put in Melbourne in the map. It's like I couldn't get it to go. It was just a whole lot of red. So yeah, I just put in who is connected in Melbourne, and these are all the people. So this is what the health link provider, and you will get this whole entire presentation and recording. This is what you would look up to see, well, who are the people that I am commonly communicating with, who I'm referring to, or who are referring to me. And one of the things, a little idea there, one of the things, an action that you might want to take from today is contact the 12 healthcare providers you are communicating with the most. Talk to them. Tell them, well, don't talk to them. Just look up online. If you prefer not to talk to them, look them up online, right? Look, there's even a little table just to give it as a task to somebody. I do not want doctors to do this, okay? Give it as a task to somebody who will support you. Who do you refer to? And if you want to know who the top 12 are, ask your admin staff, because they will tell you off the top of their head, because they are looking at those documents all the time, looking at them going, who's this from? Oh, what's it about? Oh, I know that person, especially if any of you are in smaller communities. And that is one of the things we're trying to protect. If practices don't use secure messaging, so there you go, I'm going to jump in and answer that question. If practices do not use secure messaging, hey, it's the real world, then we mitigate the risks and we use the next most efficient method of sending information. Yeah, patients don't use secure messaging. So this is where we said it's about having clear guidelines around what you will and won't send electronically, what consenting process there is, who understands, what are the risks, and do people understand the risks of emailing? Okay, it's up to you how you manage that, but there's steps you put in place. And then I cannot say this, and I'm not just saying this because I'm a trainer. Honestly, I'm saying it because I care. Your admin staff are under the pump. So they are just trying to be efficient and manage things and flick things out. That understanding of the damage that can be caused with a privacy breach or hacking, you know, that's worth thousands and thousands and thousands and thousands of dollars, let alone, you know, your reputation, so many other factors. So positives, let's focus on the positives. And what I would say is, if you are in general practice, hey, we get paid to be digitally connected and savvy. From a allied health and a non-GP specialist hospital perspective, you get more referrals, you get better communication. So it is, in general practice, what we call the EPIP is a payment. And that is, part of that is using secure messaging. So what you'll find, and I say this talking to non-GP practices, because I figure the GP practices that are listening in today, you're already with me, right? You're already going to contact Sarah straight after this if you're not already using it, or your PHN person. I'm talking to the other who may not be quite there yet. So it is really about what's that next step for you. Now, you all are telling me, I hope so, and this is where we've come a long way. I thought I read Power Diary. Somebody's using Power Diary. So Best Practice, Medical Director, ZMed, they're all examples of an electronic medical record. So if you're not using paper files, then you're already using that. If you're using My Health Record, which we all should be, because it's how you can get access to tests if they weren't sent directly to you, and also even who else is part of this patient's care team, and when did they last have a care plan. Secure messaging, it's a fundamental part. And you know what? I reckon I still would have been running webinars on, let's consider telehealth, if it hadn't been for COVID. But now, hey, and e-scripts. I literally was starting to introduce e-scripts when COVID happened, and I still would have been trying to convince people that e-scripts were going to be faster and easier and safer. And that is one of the things that has been, wow, jumped ahead 5 years. Everyone's using e-scripts and loving it. And the doctors who use secure messaging, they don't want to look back either. So I'm not going to talk to you about apps and wearable technology today, except I will say My Health app. As a carer for an older person, my mum in aged care, I use My Health app. It's helpful. And then wearable technology, like your heart bug, like, yeah, allied health. Don't even get me started down that path. That's the way of the future too. I can be a bit overwhelming, so I'll stop. But I will say this is not only, I think, the way that we need to be thinking for improving our healthcare practices, like just implementing that next step for digital technology. And that's all I would ask from today. Just do one thing. What's one thing that you can do to move your practice forward? Because I know, you know, this is just huge if you're in a practice and you're busy and you've got a lot of stuff to do already. I would just say with my Medicare, so as a national program, which is my Medicare, which is about which patients are you seeing regularly? Okay. Again, we want to be able to build those connections. So trying to draw it with my hands, the patient's at the center, and then you've got your allied health providers, your specialist practices, your hospital, pharmacy. Everybody is part of that patient's care team. So being able to communicate, and that's what my Medicare is about, saying who is your regular healthcare centre, basically. Now, Provider Connect Australia, if you haven't heard from your primary health network about Provider Connect Australia, I just thought I would put it in the context of this conversation, right? So one of the challenges we have, I'm being real here, that directory I showed you, you can look up in your software. That directory you can look up online called, you know, National Health Services Directory to see who's got vaccines, what hours are they open. That all depends on practice managers like myself diligently updating it. Now, I would ask you, you don't have to answer though, but I bet there's a lot, just nod along with me, who has had a staff member either start with your practice or leave your practice in the last year or 2 years. So especially when it comes to healthcare providers, they're coming and going from practices, yet we need to look up a list and say, where are they? I want to refer to them. Where are they? So as healthcare providers yourself, in order to be seen, you would need to be updating the National Health Services Directory. And that is what Provider Connect Australia is about. Rather than us going Services Australia, Provider, the National Health Services Directory, 50 different places to update our doctor or healthcare provider information, there is going to be one. That's the goal. Okay. So when you hear about that, know that the goal is so that when you're trying to find out who can I refer to who specializes in, you know, pediatric speech therapy, you know, that you'll be able to find and send securely. And as I think I mentioned before, I do use and recommend My Health Record as both a tool to be able to, well, you know, I don't have the latest test result. I don't have the discharge summary. I don't even know who they saw. Who were they talking about, that the specialist they saw, or when did they last, where's their summary from the GP? I don't have it. And again, I live in the real world. I had a geriatrician visit with my elderly mum last week, and he was like, I don't have the latest thyroid function test. So ideal world, he could look it up on My Health Record in his software. Real world, he was a brilliant man. Oh my goodness. And I've worked in healthcare for 30 years. He's amazing. He hand wrote his notes. So everybody is at different stages still. Take the next step for you. But know that just because he handwrote his notes doesn't mean that everything else in that practice wasn't electronic, and he was supported by staff. And we had that specialist letter sent and uploaded. I was absolutely amazed within 5 days. So everyone's at different stages. Know that if you're missing information, have a look at My Health Record again until everybody is connected and participating. It's going to be less effective. And we have, of course, test results. The discharge summaries are working beautifully. We have the, oh my goodness, the most thing I hear about benefit is being able to see the medication view. I just need to see what if they had prescribed and dispensed elsewhere. So I'll collate that for you. But talking about secure messaging, one of my favorite things, if you do use the GP software, and I know some allied health and specialists also do use it. This is a picture from Medical Director. You can send an event summary electronically. There's that little red envelope. You can send it electronically. So that's all you have to do to send once you're set up, just one click. In best practice, it's a green arrow. That's it when you set up. So easy. It's way easier than emailing. Emailing is like 4 clicks. But the thing I love about this, you could do an event summary and upload it to their My Health record at the same time. So you can simultaneously send it back to the referring GP, for example, and upload it to their My Health record at the same time, which of course the context would be, it might be, you know, say I was traveling and I saw a different doctor, not my usual GP. And I said, oh, I saw a specialist last week and they did some tests. Or so that's the benefit. So event summaries are mainly for allied health professionals who are registered with AHPRA and non-GP specialists. However, shared health summaries are mainly curated and shared by the patient's usual GP, and that in itself is what you're probably going to want and to see if you are seeing a patient for the first time. So being able to send that most private information, you know, their medications, their past history, allergies, sending that electronically so that it doesn't get into the wrong hands. Yeah, that's the goal. So we've got lots and lots. I'm going to go to questions in a moment because we've got time. I've got so many. I'll have to get Sarah to help. But know that collectively we will get back to you. This is not the end of the conversation. This is just the start and the next step. So just take one little step after today. That step might be do some further reading on this topic. And this is a great page, digitalhealth.gov.au. You know, it tells you versus email, what it is. What is this thing called FHIR? What is HL7? You'll hear these terms. These are the this is the technology terms that you'll hear in secure messaging. I didn't want to bog you down and all that today, but essentially we currently get your results in HL7 format at the moment. And I always love the whole, have you ever seen atomized results in your clinical software now where you can go, well, let's look at all the HbA1cs in the last 3 years, or that cumulative or atomized results is because that information is sent in a format that allows the information to populate the appropriate sections. So Australia has a new standard, which is called FHIR, F-H-I-R, and actually developed by an Australian world leading in this field. So it's an amazing success story in that, but that is eventually how all of our secure messaging will go. It doesn't impact on us using it, but I just thought I'd mention these terms because you will see them when you're dealing with the secure messaging providers and hopefully your own clinical information systems, which hopefully are conformant. And if they're not, send them to the digitalhealth.gov and tell them that this is something that's important to you. Because I've worked, obviously the general practice software is all great and done, and that's set up with one click. But I have been frustrated with allied health providers because, yeah, it's and my sister's an occupational therapist, we get it. It's a different environment. It's about referrals. It's about physical treatment. Often it's different context. And it's booking after booking. So as a priority for your vendors, it's not what they're hearing, so it's not what they're building. So talk to them, talk to your PHN team. If you are in a general practice, you know how I love to do two things at once. So yes, you get EPIP payment, you get PIP QI. Here you go. Here's a quality improvement activity for you. What are we trying to accomplish? Increase the use of secure messaging for sending and receiving. What's our goal? 20% by the end of December. How about that? Or if you're feeling really overwhelmed, if you're going, please stop talking, Katrina. 1%. One, use secure messaging with our main provider. Set that up, get that working. Yeah, I love to have small goals because then I can go, yay, we did it. But you are spending a lot of time and money at the moment managing patient information, probably not as safely as we should to meet those privacy guidelines and our standards for healthcare. I don't want any issues of breaches or potential hacking. So all of that, I think, is now timely to go, could we be doing things better? Look, indemnifiers and the privacy principles, sometimes we need to go back to that. I know in healthcare, especially if you've come from a hospital setting, we can get a little bit like, well, patients consent to everything because they're my patient and we can talk about everything and share everything. And it's like, no, that notifiable data breach that I was mentioning before that traumatized my practice manager colleague, it was literally this scenario where instead of sending the receipts for the work cover claim for that patient by email, the receptionist attached the whole batch, so 100 patients' claims to that email and sent it to the patient. It's as easy as that. She was just stressed, less careful, and what an absolute nightmare for the practice, the patient. Every patient had to be contacted, hundreds of patients had to be contacted. So good time for retraining about what are we doing in the practice. A lot of new staff may have had training, and if you're using email, do it as safely as possible and then work towards this goal of setting up secure messaging.
Thank you so much, Katrina. This is fantastic. I'm just going to, we can actually leave this on screen, and if people would like to give feedback now, they're very welcome to. But there'll be another prompt at the end as well. I'm just going to go through some of the questions that have happened throughout the session that we haven't quite got to. There are a few, I think some probably have been answered, but there's some great comments around cost. How do you tackle, because, you know, they all have different costs. Practices are often struggling to cover these things. Have you got any advice, Katrina, on how someone might go about choosing secure messaging, perhaps?
Yes, I do.
Yeah,
I do.
And I think,
well, I think that there is no point getting secure messaging that your referrers or your referees aren't using. We need to all be on the same page. So our first step is to go, well, what are they using? To contact them to find out about the price, and then sometimes that's based on number of providers. A lot of the time you can negotiate. And then the other thing I would suggest is it an additional cost, or is this going to save you admin staff time? So if you think about that, this document is now going from the healthcare provider with one click to the recipient. Sometimes what I'm seeing is that document is going to the receptionist, who is then scanning, emailing, faxing. It then comes back in that format. So then they're receiving, importing it into the inbox, managing it. If you're using GoFax, it's like renaming it. So that, what is that time worth? So that's that. It kind of makes me feel better if I can go, well, actually, we're now spending, 2 hours of admin time a day doing this, which is, that's going to make it equal value. So I hope that helps a little bit. I know there just seems to be more and more costs in a practice, but sometimes it's not an extra, it's just, we'll take that one away.
Lovely, thank you. And we had a question right at the beginning, which was around, what if clients use email to share information with you, whether it's discussing children or, what do you have to be mindful of in that scenario?
And they not only do that, but they put pressure on you to do that, right? So it's like, and sometimes, I heard the other day, one of the doctors said, well, if I can't email, I'm not going to work here. So it is that pressure. So what I would say is implement processes to do it as safely as possible, empower your staff with a dialogue, so that we can say, we will, for example, this is at the top of my head, we may consider receiving emails. However, this is the process that we would follow in order to do that. And then have your process, your protocol on your website, have it so that you can share it on your Facebook page or however else you communicate with patients. So, and then it is, again, that risk assessment, that's the indemnifier side of my brain going, what is it that they're sharing? If it's something like, I don't know, I need a long appointment, versus sometimes patients share way too much information. Sometimes you have that, I'm just trying to get information because I have a difficult family situation. So, and again, that's where staff training comes in. So the more pushy you are and louder you are with me, the more the little flag goes off in my brain and I'm like, back to the dialogue. I hear that that's important to you. However, in our practice, we have a protocol, whereas we do this. And that is to ensure that we're protecting the privacy of your health information. So work it out with your staff, have a little dialogue. So what you can do with identifying, I see a message about identifying. Clients, patients want to share information. Oh, I know, we all do. I get it. And I do too. It's just so difficult. You do it in a business. However, that's where I said, go back to what is it you're sending? Who are you sending it to? What is the sensitivity of that information? And have a protocol in place for it. I'm not saying you can't use email at all, because, I kind of think you have to right now, but let's minimize it and then have a good protocol in place. When it comes to identification, I can't say this loudly enough. If you're not in general practice, use the RACGP standards. 3 identifiers at every single contact. If you're at a hospital, I'm sure you are so good at this. You do it so well. No one gets past you without going, I need your name, I need your date of birth. Now, is that the left arm or the right arm? But what we do from an administrative process is we need to check that identification. But now we also need to check, can you please tell me your mobile phone number and your email? Get them to tell us, because otherwise we're breaching privacy by we just told them there's somebody else with their name who's got that information in our file. So verify, and I just take it back to where I started. That was 25 healthcare professionals who gave me the wrong email address for themselves. We're all busy, we're all working fast. That's how accidents happen. And it is as easy as that to breach a patient's privacy. And then, oh my goodness, talk about taking up your time. And I don't want that stress for anybody. Or the patient, because the patient's devastated by privacy breaches as well.
All right, lovely. Thank you. There's still more questions coming through. However, we are out of time, unfortunately. But I will go through the list and have a look who we can follow up with to talk to you outside this session. please do provide us with some feedback. There'll be a pop-up when you leave the room, and we will share the slides. So you can see here we've got the contact details for your local PHN to get some more support or talk about secure messaging. So we'll share the slides with you and the recording and the video and any other resources that we've discussed. Thank you, Katrina, so much, and thanks everyone for coming along.
Thank you for sharing your time, and I wish you all the best.
Bye, everyone.